Hi, I'm Dr. Ross.
And I'm Dr. Tiamno.
We're a developmental optometrist.
Thank you for your interest in vision therapy.
Most people have heard of physical therapy or occupational therapy or speech therapy, but many people haven't heard of vision therapy, even though it's been around for over 90 years.
Vision therapy is a series of activities designed to improve the function of the visual system. It's all about efficiency. A coach once said, if you have to think about it, you've already lost.
Think about hitting a baseball or driving your car. You have to make split-second decisions. If the decision isn't automatic, and if you have to think about it, then you're probably going to miss the ball or even get into a car accident.
Consider reading. If you have to think about every little thing that you have to do while you're reading, looking at a word, tracking across the page, physically focusing your eyes, and putting the two pictures from each eye together,
it'd be difficult to concentrate or comprehend or remember what you've just read. You'd get tired and you wouldn't have the stamina to keep it up. Reading is much more than just the individual parts and putting the words together. The purpose of reading is to understand what you've just read.
Some kids might just lose interest in reading or think that they're not as smart as the other kids in their class. It may begin to affect their self-esteem. Sometimes children don't even want to try and they say, I just can't, before they even try.
In vision therapy, we start with activities that are relatively easy, and then we gradually ramp it up and we change it so that they become more complex as time goes on. The goal is to get to the point where these skills are efficient and automatic, so you don't have to think about what you're doing. You just do it, okay? It's kind of like when you first learned how to drive a car.
At first, you needed to remember to hold the steering wheel at 10 and 2, then put the car into drive, press on the gas, look in the rearview mirror. Eventually, it just became automatic, and you didn't have to think about all the different parts. Similarly with reading, you just want to be able to read and understand, rather than to have to think about all the steps.
When reading, the intent is so that you're able to spend less time in the physical activities of moving your eyes and more of your effort in understanding and comprehending. When can you expect to start seeing improvements? Well, it usually takes someplace around 6 to 8 weeks for patients to start to develop these skills and then transfer the skills to the real world.
By that time, the patient has more stamina for homework and reading. A child will begin to understand what they're reading rather than spending the effort to bring in the visual information. Adults will start to notice that they have fewer headaches when working on the computer, for example. For more information, contact us at 732-679-2020 or visit us on our website, www.njisite.com.